To perform the accessory glides in the cranio-vertebral region, specifically the C0 or occiput on C1, you're going to use the football grip. First one I'll demonstrate is the anterior glide on the right. My left arm is going to lie on the pillow and gently go around the chin. Then I'm going to slide off the occiput. Just below the occiput is the posterior arch of C1 on the right. Then I'm going to perform bilateral chin poke, or C0, C1 extension, but that gets both anterior glides. Then I'm going to side bend by watching the nose, just the occiput, to the right and rotate to the left. Then I'm going to take my hand that's on the back of the occiput and glide the right side of the occiput towards along the line of the mandible. I can assess in this position or I can treat in this position. If I want to do the posterior glide of that same joint, I'm going to switch my arms. Of course, I would assess the opposite side and compare the left to the right. But for the video's sake, to do the posterior, I have to do right rotation to get the right posterior glide. Right rotation goes with left side flexion. And I have to add the bilateral flexion first. So this time I'm going to roll her head to the left, put my right forearm on the pillow, and roll her head back onto my forearm. Again, my hand will rest on her jaw because it's where it lands naturally, but there will be no pulling on the jaw. I am going to snuggle, cause the bilateral flexion, watch the nose, so as I side flex to the left, I only get the occiput on C1, and then pushing with my left hand, I get that little tiny bit of CV right rotation. Now, in order to do that right posterior glide of the occiput, I can pull with my forearm on her occiput, but I could also push with my shoulder on the top of her head. And that's causing a right posterior glide of the occiput on C1. I would compare that to the opposite side. To do C1 on C2, I am going to put my thumbs on the anterior aspect of C1 on the right and the anterior aspect of C2 on the left. I am going to assess her right rotation and the posterior glide of C1 on C2. So I'm going to first slacken her left alar ligament and follow the biomechanical rules. So right thumb on the anterior aspect of the transverse process of C1, which we find between the angle of the mandible and the mastoid process. On the opposite side, I will find the same spot for C1, but I will slide down just a little bit and know that I'm on the anterior aspect of C2. Then I'm going to slightly side bend to the left, rotate to the right until I feel the barrier. At the barrier, I am going to stabilize gently on the anterior aspect of C2 while I push on the anterior aspect of C1 to assess that glide. To perform the posterior glide of, now that was the posterior glide of C1 on C2. To perform the anterior glide of C1 on C2, I'm going to come to the posterior aspect of C1 by rotating her head to the right, sliding my second MCP, radial aspect, also known as Bob, just below the occiput. I am now on the posterior aspect of C1 on the left. I need to find the posterior aspect of C2 on the right, but thankfully C2 has a really nice big spinous process. So I just come to the right side of that spinous process and I'm on C2. Now I'm going to, I'm assessing right side, right rotation. So I'm going to do a little bit of left side flexion. I'm going to rotate the head to the barrier. And now, while maintaining a gentle anterior glide on the right C2, I am now going to anteriorly glide the left C1, assessing the quantity of movement and the quality of the end feel. And that's how you test the accessory glides in the cranio-vertebral region.